I think you are already familiar with my name. My name is Nazwa Tahsin. I am currently the regional project manager of Neurolandscape. It's a basically NGO based in Poland, and we do a lot of research based on neuroscience and how we can implement evidence-based design in different cultures and contexts. And today I'm going to present research that we are currently working on, which is community-led nature initiatives in Dhaka and Medellin. Sorry.
Yeah, carry on.
I think, yeah. Uh, So we have a big team of people from different cultures and from different countries. The main target of Neural Landscape is to promote like livable cities with a main focus on green spaces and mental health of the people. Now, there are a lot of tools for neural landscape. We do research, but we also do communication through campaigns and publications. We do consultancy and also evaluate different landscapes and certify them if they are fit for people's mental health. And we also advocate for nature preservation and conservation. So the research scope of nature connection and mental health and well-being is quite vast. We can study it from the people's individuals' perspective by seeing their characteristics like their physical ability, their age, and other aspects. Then we can also study these connection with nature and how they promote mental health and then well-being through the activities we conduct within that landscape. And the features of environment also has impact on mental health and well-being, like what type of trees are there, what are the characteristics, the canopies, nature, like the typology of the trees and so on, and also the mechanism of the whole aspect of these three elements can have impact on mental health and well-being. So because of the depth of this domain, Neural Landscape has three major programs. One is artificial intelligence for mental health and healthy cities. We have neuroscience and evidence-based design, and lastly, nature connection and mental health and well-being of communities. The third program is where our research comes into. So, which is the name of the project is Planting Seeds of Empowerment, Health and Well-being of Communities. And the major thing why we took out the project is because we're observing a huge growth of cities throughout the world, especially in developing countries. We are observing that there are a lot of people coming into the big major cities for economic reasons and for sometimes even environmental and climate change related reasons. And because of this huge influx, the number of informal settlements are also growing in these places, which are imposed with violence, imposed with emotional stress, and also other issues that can have really adverse effects on mental health and well-being. This is the reason why we chose to do this research. Now we have a big team of volunteers in our organization to conduct this research. It's quite diverse as well, and the major questions that we're trying to uncover is how these communities adapt into such adverse environments where there's so much violence and so on, and whether they're trying to connect with nature as a way of their own awareness, agency, or just from the sense of community. So we initially observed that there were some nature related activities within the communities of Dhaka and Medellin. So the questions we're trying to answer is how these type of bottom up actions emerge, who are these actors involved in such activities, what are the place-based, like what strategies are they taking on, what type of knowledge they're using, and is it empowerment? Are these people getting empowered, or they're doing it because they're already empowered? and what type of characters these spaces have, like what are the spatial characteristics of these landscapes or their initiatives, and lastly, if these activities have any potential to assist them with mental health related issues, like are these activities helping them with stress relief, is it creating some sort of networking within the community and thus creating any sense of community within the people, and so on. So we took out this methodology of comparative case study approach where we studied the complexity of these actions through emergent sequential study design. So what we basically did to do that is, firstly, we conducted some interviews of the stakeholders involved in the places that we are studying, and then based on those interviews, we did some psychometric studies, surveys. And lastly, what we are now trying to do is explore these spatial characteristics through some spatial evaluations and through spatial indicators. Now, as we mentioned, the project is currently done in Dhaka and Medellin. Dhaka is the capital of Bangladesh, and Medellin is the capital of Colombia. Now, let me first give you the idea of what's going on in Dhaka. We have done only one case in Dhaka, which is in Tejgaon railway slum. Now, we selected this slum because there are a lot of slums in Dhaka, and the population is more than 4 million. Actually, it's probably even more than that. So we had to narrow down our scope for the initial exploration. So we took 7 features, basically if there was any green initiative in the slum, or if it is accessible or not, and so on. And based on that, it seemed like the Tejgaon railway slum was the good fit, perfect fit for the initial study. So what we found that it is extremely densely populated slum. So there weren't a lot of open spaces or cavities within the community to do large-scale gardening. However, the amount of space they had in front of their houses and on their roofs, they had some pocket interventions. So what they were doing is they were planting in front of their yard or on the rooftop, and sometimes they were even trying to shelve and put some buckets and plant on those places. And when we asked these people, like in our interviews, why they were planting, what was their reasons, the main reasons that came up was that it soothed their mind, it looked good, but also it was quite multi-purpose. And they also find that having plantation helps with nutrition and with sometimes even economy as well when they have extra produce. And another thing that we noted is that in Dhaka's context, mostly women were involved in such interventions. We also found that people were doing it very spontaneously, and we saw that the structures were mainly rooftop based, like those were the most prominent ones. And we also observed that they were using not local materials, but materials that are found in the rural settings of Bangladesh, not in the urban setting, which was very interesting. So we interviewed them as well, like why was that so? And we found that most people were migrants from rural areas, and they were using that rural knowledge, local indigenous knowledge, in that urban setting. Like they were trying to replicate what they saw in their rural like earlier life, and then trying to use that knowledge now and teach that knowledge to their children and pass it from their generation. And when we're doing this whole project, we were interrupted with COVID, but we took it as an advantage for ourselves. So we also did some studies to see if COVID had an impact on this plantation related activities, and we found that after COVID, people had more realization of need of nature, and also that it has some sort of impact on their mental health. They could identify a link between mental health and greenery. But unfortunately, the place was evicted recently in February, so we couldn't capture any photograph of the greeneries. However, we found that through our interviews through phone. Now let's go to the case of Medellin, which is a City in Colombia. We did 3 case studies. We are doing 3 case studies. We have done 2, and we are on the 3rd one at the moment. So the first one is Comuna Villatina, which is Comuna 8. Then we have Comuna 4, which is Comuna Moravia. Then we have Comuna 13, which is Eduardo Santos. Now, in Eduardo Santos, we saw that both men and women were involved in maintenance of their public spaces, and they were also using these public spaces for social and environmental actions, mainly as a mode of enjoyment too. Like, they were enjoying maintenance of such places, which was very interesting. We also saw that people were individually were engaging in such places for enjoyment or contemplation as well. And also we saw in this community that people were doing some farming activities, which they found very fruitful for their financial support. And then in Comuna 4, we saw that there was a mixed approach where the communities were mainly involved with the management of green spaces. However, there was in the top-bottom approach side of this like nature-related action, it wasn't the government, but the academia was involved here. So what academia did was they initially funded and also provided knowledge to the community, and the community received that knowledge, and then they kind of worked on building these green spaces and then using it. And based on our service, these green spaces were heavily used by the people. However, we couldn't have these photographs because of COVID. So the primary conclusions that we can draw from the cases of Dhaka and Medellin is that, first of all, we saw that having leaders has an impact on the emergence of such actions. Like, when there is, it doesn't have to be necessarily a political leader. Rather, when there is like strong sense of community, and the community has that 1 or 2 person whom they can rely on, such type of leaders help emergence of these activities, and then people feel safe to do such activities. And also we saw that individual actions can be sustained in the long term, and different levels of activities can also emerge throughout time. And during COVID, we saw that such type of green activities can have a healing effect on people, on their trauma. We saw that more people, like before, and when we compare before and after COVID impact, we saw that more people were saying that these green spaces help them with stress relief. It also helped them with distracting themselves from the harshness of losing job and other political unrest events. So those were some, we can narrate that these have some healing properties as well. We also saw that in COVID, the actions were mainly, agriculture based to assist with their economy. Then there was this, because it was having a positive impact and people were more aware of it. So people had this notion of protecting these green spaces as well. And also there was education programs emerging in both Dhaka and Medellin. And lastly, we also observed that people were, more understanding that these type of initiatives can help mental health and well-being of both children and adults, which was very interesting. We also saw that people were, as they were getting more conscious of these initiatives, they started to do some emotional designs. So basically they were trying to plant trees and making those places green in their kitchen or the front yard and farming spaces for mental support, because these places are extremely limited in terms of area. So in conclusion, we can say that such spaces can have healing properties, and it can help people realize the need of emotional design, and it can even promote that participatory emotional design. And lastly, it seemed that in both of the cases, these places were bringing people together and creating a network where people can share their knowledge, share their ideas, and it can create a bond that can help them pass through difficult times. We actually have done a book chapter in Springer, which is in press at the moment. So I hope when it gets published, we will be able to share it with you guys. And that's pretty much my presentation. So thank you for giving me this opportunity. I would like to say that we'd love to collaborate with others. We would love to do this sort of research in other cities, in other spaces, because the topic is quite new and also very interesting. And I hope that if someone feels like to collaborate, you can simply email me or Diana. The links are all given in the screen. So thank you so much.
Thank you.
Thank you so much, Nazwa.